Hi everyone, I'm Noor Azimah Muhammad from the National University of Malaysia. Together with me, we've got Dr. Jasmine from International Islamic University, Rosediani from University Sains of Malaysia, and Sharifah Hazuraida from University Sains of Malaysia. We've just presented our work at the symposium this morning. We talk about the role of religion and culture on the sexuality of the young people as well as adults, mainly women. I shared my work over the last 10 years or so is about the young people's sexual activity where despite the prohibition not to practice premarital sex, the youngsters still perhaps just about 10 to 15% are sexually active. So the movement, or perhaps our initiative now, is to promote sexual education at home. We want the parents to start talking about sex, educating the young people. Hopefully that would lead to a better, healthy sexual life. Yes, Jasmine?
All right. Thank you, Dr. Azimah, for the kind introduction. So basically what I talked just now during the symposium this morning is about sexuality in postpartum women, especially for Malay women, because it's actually a taboo thing to talk about. So basically, most women in Malaysia do not speak up or voice out their concerns on sexuality. So they really just keep quiet because they know that their role is just caregiving. So sexual pleasure is secondary to that. So our study found that the prevalence of female sexual dysfunction is quite high among our Malaysian women. So I think it's important to create awareness to all Malaysian women about sexuality, and they can actually seek help with their healthcare providers and talk about it openly and not be shy about it. Thank you.
Hi everyone, I'm Rosediani from University Sains Malaysia and also AOFS President. Today actually I talk about sexuality among adult women, in which we can see the influence of religion, culture is really a lot, in which we can find that the prevalence of FSD among Malay women even as high as 90% in breast cancer patients as compared to general population about 30%. And this contributed by so many factors, but in terms of culture, or what we call adat, the main thing that I want to make sure everybody understand is about the adat actually a little bit conservative or patriarchal. Yeah, because the adat, stood men in front. Yes, of course, in Islam also men in front. But in terms of giving understanding about sex, understanding about pleasure within the relationship, understanding about their relationship, I think is still a little in our community. So I think we need to go and make a more awareness on that issue and try to include Islamic scholars so that what we call the Islamic misbelief, because sometimes the community actually have some misbeliefs about understanding about Islamic related to sexuality. By right, the Prophet said we should give pleasure, make sure everybody can get their satisfaction, everything. But in reality, it's not like that. So we have to go and work together, everyone in the community, and talk about it and normalize sexuality, sexual health, especially in our community. I think that's all from me.
Hi, I'm Sharifah Zubaida. I talk about my PhD research, which Prof. Rosediani is my main supervisor, and she's the one who actually asked me to join this symposium or this congress, and I'm delighted that I'm so grateful that I can share with all great women here today. So I shared about adult non-heterosexual Malay women, how they are a minority identity and have the challenges in Malaysia who prohibited these non-heterosexual activities, which can lead to conflict, internal conflict, external conflict, and lead to mental health problems. And what we found that in terms of how they manage their conflict is these women try to find new meaning in life, in which they search for religiosity and spirituality to handle their conflict and being a better Muslim women. So that we conclude that probably that a biopsychosocial spiritual approach in managing mental health problem among adult non-heterosexual Malay women is a valuable a module that need to be implemented now and for future.